mynews.studio.
Picture this. There's a cholera outbreak, and a team of health workers arrives by drone, bringing vaccines that could save the entire village. What does it actually look like when global coordination steps into a local emergency?
Today's date is 2025-7/31. A new report from the British Medical Journal highlights that emergency vaccination campaigns in developing countries have saved over 300,000 lives since 2000. We're talking about diseases like measles, cholera, meningococcal meningitis, yellow fever, and Ebola. But how are these campaigns able to achieve such large-scale results in places where health systems are often fragile?
It's all about quick action and smart logistics. Organizations like Gavi and the WHO keep vaccine stockpiles ready to deploy. When an outbreak hits, mobile teams, often made up of local health workers, take those vaccines into remote areas. Sometimes it's by motorcycle, sometimes by drone if roads are blocked or unsafe. They plan out every village, every household, using microplanning to make sure nobody is missed.
But vaccines need to be kept cold to work, right? How do they manage that in areas without reliable electricity?
They use a mix of cold chain solutions. Solar-powered refrigerators are a big part of it. There are also portable, battery-powered coolers. The main goal is to keep vaccines at the right temperature from the warehouse all the way to the most remote sites. And if something goes wrong, teams get real-time data so they can adapt quickly.
So it's a combination of tech and local know-how. But it's not just about moving the vaccines, is it? How do they actually persuade people to get vaccinated?
Community engagement is essential. Teams work directly with local leaders to build trust and answer questions. Sometimes there's a lot of hesitancy, especially in conflict zones or places with misinformation. Outreach can mean going door to door, setting up temporary clinics, or even combining vaccination with other health services like nutrition programs.
And the international partners, Gavi, WHO, UNICEF, and others, they're the ones providing funding and technical expertise?
Yes, international organizations coordinate funding, buy vaccines, and offer technical guidance, but they always work through national governments and local health authorities. The real focus is finding outbreak hotspots, training local teams, and getting resources where they're needed most. Monitoring systems help track who's received vaccines and where there are still gaps.
Let's talk about the impact. The report says these campaigns have reduced deaths by about 60% and saved $32 billion. How do they come up with that figure?
It's not only about the lives saved. Preventing outbreaks means less money spent on emergency care, fewer people missing work or school, and a more stable community overall. Every outbreak stopped helps keep the local economy going, especially in places that are already vulnerable.
What happens if funding drops for these programs? Are we looking at a risk of old diseases making a comeback?
That's already starting to happen. WHO and UNICEF have both warned that funding cuts, conflict, and misinformation are bringing back diseases like measles and yellow fever. If immunization rates go down, herd immunity weakens. Outbreaks become more common and much harder to contain.
And that's not just a local issue. Diseases can cross borders, can't they?
Exactly. Weak immunization anywhere can put everyone at risk. New or old pathogens can trigger epidemics, even pandemics. Keeping these programs funded is really about global health security, not just helping one community.
So to wrap up, coordinated emergency vaccination programs have saved hundreds of thousands of lives and billions in costs, but the progress is fragile. Ongoing investment and international cooperation are needed to hold on to these gains and protect the future.
The evidence is strong and the strategy works. The real challenge now is making sure we don't lose momentum.
That's it for today's episode. Thanks for joining us. And just remember, the image we started with, drones bringing vaccines to remote villages, isn't just a headline. It's proof of what can happen when science and cooperation come together at the right moment.
Thank you for listening. This episode was powered by mynews.studio. Try it now for free.